Hello, this presentation is about practice-based developmental and behavioral interventions to enhance quality of care in the first 3 years of life. It is in partial fulfillment for the Doctorate of Nursing Practice course, Biostatistics for Dr. Vicki Krentz. Why do we need this program? There's evidence that there are deficiencies in the quality of care for children. There's a lack of preventative care, lack of usual source of care, especially among minorities and low-income families. There's specific limitations that have been noted as far as the behavioral and developmental areas of care. And there's gaps that extend to the differences between the recommended care, so the evidence-based care, and the care that the actual patients receive from their providers. Healthy Steps for Young Children was designed to meet the needs of these families regarding their young children's early development and behavior by enhancing relationships between parents and their children, between the families and their pediatric providers, and amongst providers themselves. Healthy Steps aims to enhance the capacity and effectiveness of pediatric primary care by incorporating developmental specialists into the pediatric practice. The program was designed for all families, not only those at risk for developing behavioral and developmental problems, recognizing that all parents have concerns and questions about their children's health, development, and behavior. Healthy Steps program included contact with practitioners specially trained in the Healthy Steps Behavior and Development program. These specialists are called Healthy Steps Specialists. The Healthy Steps program consisted of 7 services to intervention families. They were enhanced well child care, developmental assessments, 6 home visits, telephone hotline advice by the Healthy Steps specialist, written materials especially pointed at disease prevention and health promotion and safety, parents groups. The Healthy Start specialist helped parents form groups and encouraged attendance and participation in these groups when needed. And they also gave referrals and linkages to community support groups when there was identified need. So the purpose of the study was really to test the impact of implementation of the Healthy Steps program on quality of early childhood health care and parenting practices. The design and methodology. This was a prospective controlled clinical trial, and they used 6 randomized and 9 quasi-experimental sites across the United States. There were 5,565 children enrolled at birth and followed for 3 years. As you can see, this chart outlines the randomized sites, the quasi-experimental sites, that the randomized sites were randomized into the assigned intervention group and the assigned control group. The quasi-experimental sites were enrolled in the intervention group and the control group, and there were approximately equal numbers in all of the design sites. Looking at the demographic and characteristics of the participants, the mothers, they were fairly similar except for 3 parameters. 1, the mother's education in some of the sites was slightly higher than the average. The race tended to be more Caucasian, and also the family income at some of the sites was a little bit higher than others. So the things they were measuring in this study, they used the parameters of quality of care outcomes, and the outcomes fell into 4 care domains. They outlined effectiveness, patient-centeredness, timeliness, and efficiency. They also looked at parenting outcomes. The variety of parenting outcomes were analyzed, and 3 categories were parenting response to misbehavior, perception of the child's behavior, and promotion of child development and safety. Getting a little bit deeper into what they analyzed as far as effectiveness, they looked at if the participants in the intervention group received 4 or more healthy step related services. Any of these services were counted in the statistics, and they looked at the 6 items in the Cronbach Alpha and for receive more than 4 healthy visits, and then also for discuss more than 6 topics. Those were all the categories, and they also used Cronbach Alpha to look at that. In effectiveness, they looked at receipt of home visits, that the patient's child had the developmental assessment done, they received books to read to their children, and information about community resources. For the patient-centeredness, what they were looking at is that they polled the patients to see if they felt like someone went out of the way to help them, the amount of disagreement between the pediatrician or nurse practitioner as far as if they felt like they were supported or support was provided, if they felt listened to as a parent by their provider, and also to if they felt respected as a parent by their provider. All of those that were multiple responses also had the Cronbach Alpha used. So as far as timeliness, what they looked at is if they received their age-appropriate well-child visits, if they received the appropriate vaccinations and at the appropriate times, and also too if all their vaccinations were up to date. And as far as efficiency, they looked if they had had a last visit after 20 months, hospitalization in the past year, emergency room visits in the past year, and also too, if they had emergency room visits, were they for injury-related issues? As far as the parenting measure outcomes, they looked at the parent's response to child's misbehavior, and what they did is they looked at the discipline type. So did they ever physically discipline their child, use harsh discipline with their child, or did they negotiate or ignore the behavior? And as far as their perception of their child's behavior, they looked at if they displayed aggressive behavior, anxious or depressive behavior, or they had reported sleeping problems. Their child would have sleeping problems. And then also too, they looked at promotion of child development and safety. So they talked about sadness, they talked about reading to the child, they talked about playing with the child and having them have a normal routine each day, and also safety features of the home. So for the data collection, they did patient questionnaires. They also did provider questionnaires, which were not discussed in this presentation, but they looked at if the providers thought that the patients benefited from these interventions. They did actual patient interviews. They interviewed them in person at the beginning of the study, and then over the phone at 2 and 4 months, and then between 30 and 33 months, and compared those results. They looked at medical records and for immunizations, visits, and emergency room visits. And they also did verify for inter-rater reliability. They looked at a certain percentage of the charts. A different person looked at the charts and made sure that they were seeing the same thing. And then they also reviewed the Healthy Step Specialist logs because they wanted to assure that the interventions that they were delivering matched what they were trying to study. So the parent outcomes were based on frequency. During the interviews, they asked the parents to rate how many times these things had happened over the past 7 days. They range from 0 to never to 3 almost always. And what they did is they grouped these into the upper and lower ranges, which were 0 to 1 was never and seldom, and 2 and 3 was often and almost always. And they could also constructed a scale which was just to include the harsh behaviors such as yelling, threatening, spanking, or slapping with the hand, because they wanted to analyze those separately, as did they do with the very harsh behaviors, which were slapping in the face or spanking with an object. And other parenting outcomes that were assessed together were ignoring behaviors and negotiating, because that was the positive discipline part they also wanted to analyze separately. They wanted to assess the depressive symptoms of the mother, so they used the Center for Epidemiologic Studies depression scale, and they used an alpha coefficient of 0.86, which they found was similar to the total scale in the general population samples. So the randomized and quasi-experimental sites were analyzed separately and combined. They used a bivariate analysis to compare the distributions of the quality of care outcomes and the parenting practices. They used the chi-squared statistic for the categorical variables and the t-statistic for continuous variables. They used regression models to estimate the overall adjusted effects of the healthy steps, and all the statistics were performed using the SAS software, and the p-value of less than 0.05 was used to determine statistical significance. So the results of the quality of care outcomes, what they found in all of the general categories, there was statistically significant results in the groups that got the intervention. As far as effectiveness goes, patient-centeredness, timeliness, age, and efficiency. The groups that received more than 4 services received home visits greater than 6 months, and in patient-centeredness, they reported a higher degree of satisfaction with support, being listened to, and being respected as a parent. They also reported that people went out of their way more than often to help them. The children were up to date on all of their, not all of their, but they were statistically significant more people that attended their well child visits, were up to date on their immunizations, had been seen in the last 20 months, and actually it extended on beyond the 20 months because they were seen up to the 36-month or 3-year mark. There was more that continued with their care. Also, in the adjusted odds ratio, the interesting finding was that in efficiency, you can see at the bottom of the scale, even though there was no statistically significant result as far as number of hospitalizations in the past year or number of emergency department used in the past year, there was a statistically significant decrease in the number of visits for injury-related causes. And the same with the frequency for parenting outcomes. They found that there was less harsh discipline, more negotiation and ignoring, and a lot less slapping in the face and spanking with an object. Interesting, they found that there was more aggressive behavior and sleeping problems, but they attributed that to the parents paying more attention to the behaviors of the child. So, the odds of receiving developmental-oriented care were 4 to 20 times higher among the Healthy Steps families. Parents in the Healthy Steps group had reduced odds of slapping their child in the face or spanking them with the object. And children who received Healthy Steps had better continuity of care. The value of Healthy Steps interventions compared to other developmentally focused interventions was much less. The study through statistical analysis demonstrates which outcomes the interventions affected. The analysis helps us pinpoint which outcomes would be similar regardless of intervention. The analysis helps us focus our limited resources on the interventions that will have the most impact on outcomes. We use evidence-based interventions and statistical analysis to fine-tune our care, thus providing care that has the greatest impact on the desired outcomes. Thank you.